there were a couple of questions. So going back to the risk-reducing medications, Judy, are there any long-term risks of tamoxifen to general health? So Brittany spent a lot of time talking about the serious side effects and the more quality of life side effects, but if someone takes their course of tamoxifen for 5 years and they don't have any of those serious side effects, are there any other long-term risks people need to be concerned about?
I don't think so. It's really remarkable when you think about it. It does, the beneficial effects seem to be long-term. Fortunately, the adverse effects, especially the symptomatic ones, all those hot flashes and leg cramps and things, those go away as soon as you stop. And the risk for the serious side effects really, we would say, extinguish, but they disappear as soon as you stop the medication. The only one that takes a little bit longer is that uterine cancer risk, and that decays over the next couple of years and then is gone. So fortunately, no long-term side effects from tamoxifen.
Great. A question about the contrast used for MRI. Dr. Garber mentioned gadolinium, and also in contrast enhanced mammo, which is the new tool that we are hoping to bring into our research soon. That contrast is the same contrast, the iodinated contrast as you'd have with the CAT scan. So in all contrast enhanced imaging modalities, the contrast is given IV, which means it goes into the entire circulation. So there's really no way to just have the contrast go to the breast. And of course, that's one of the risks of using contrast that people have to be aware of when we make those decisions, is that there are small risks of allergic reactions to some of these contrasts. And with gadolinium in particular, there's some emerging data that there may be some deposition of gadolinium in the brain over time. We have no evidence that it is problematic or causes symptoms or causes any health problems for women. But we do have to talk about, all the pros and cons of these tests when we're talking about how to incorporate them into an individual woman's strategy for surveillance and for long-term follow-up. And then I'll just quickly answer one more question before we move on to the relaxation part. This question was about if both atypical hyperplasia and LCIS are found, does this put a woman in a higher risk category? And the answer to that is as far as we know today, the answer to that is no. We don't add the risk from those individual lesions together. We focus on the lesion that has the highest independent risk, and so that would be the LCIS, carries a higher risk than the atypical hyperplasia. So it's a bit of a hierarchy, and we focus then on what is the most important driver of an individual's risk. So